This evening we've had the annual general meeting of both NHS South Cheshire Clinical Commissioning Group and NHS Vale Royal Clinical Commissioning Group. We had the annual general meeting as our absolute bringing the accounts, presenting how we spend the money. It's also a real opportunity to showcase and to demonstrate to the local population that we serve the work that we're doing, the projects that we've got in place, the initiatives that we delivered over the past year, and start to talk about what our plans are going forward.
I think it's important for us, to get out of the offices and come to meet people, but we tend to speak to the same people a lot of the time. But when we come to events like this, we get to speak to people who don't normally engage with us. So a lot of people have come to us tonight that really haven't known what we've been doing, and actually be able to talk to them and get some of their issues that we can hopefully use then to develop things going forward. So I suppose the key is just meeting new people and getting new people engaged.
The marketplace format has been fantastic, and it's really enabled that kind of networking to take place. A mixture of local people, of people commissioning services, providers, and that kind of dialogue has been really interesting. I've met lots of people who I've worked with before, but equally lots of people that I haven't worked with, and managed to make some connections that we can sort of take forward as an organisation in the work that we carry out. So it's been really, really interesting and really enjoyable.
I came here today because I wanted to learn more about the healthcare services available to me. I thought it was really interesting because I found out about where they spent money on things that would help me and where I lived to help people that I knew and that I didn't realise before.
I think it's been really successful. It's always fantastic to have an opportunity to come and talk about the work that we're doing, but most important is the opportunity to listen, to be able to have the conversation with people, to hear what their views are in terms of local health services, what's working, what we need to be working on to improve. It's also been an opportunity for us tonight to launch Cheshire Chat. So we're starting a real approach of having a consultation, having a conversation with the local population around what their views are on healthcare. We want them to be working with us to help shape what healthcare services start to look like going forwards, to make sure that we get that right.